BSI, is my scene safe?
Yes, it is.
My nature of illness is I was dispatched to a male with chest pains. Number of patients, I only have the single patient. At this point in time, I would consider additional help since he is complaining of chest pains. It's a possible cardiac. I'm going to go ahead and start ALS ambulance to assist. C-spine considerations. Sir, did you fall down at all today? You've just been sitting here?
No.
Any neck or back pain?
No.
Okay, so I'm going to go ahead and rule out having to worry about C-spine at this point in time. My general impression of the patient is he appears to be in some sort of pain, possibly having a little bit of difficulty breathing, about a 44, 45-year-old male. Level of consciousness, he was talking to me, so obviously my patient at this point in time is conscious. Sir, can you tell me about what time of day it is?
It's like 2:30 in the afternoon.
Okay, he does seem to be alert to time. Do you know where you're at right now?
Yeah, I'm at home.
Okay, and he's good with locations. Sir, what's your chief complaint today? What's the main reason you call us?
I just got terrible chest pain.
Okay, are you experiencing anything else we need to worry about right now?
My arm is tingling.
Okay. Airway, he's talking to me, so I know he does have one, but I'm going to go ahead and assess that a little bit further. What's my rate and quality for respirations at this point?
His respiratory rate is at about 18. They are somewhat shallow.
Okay. The rate is good, a little bit shallow. I'm going to go ahead and help that out by hooking up a non-rebreather to 15 liters per minute, and I'm going to administer oxygen using that. Does that oxygen help you out breathe a little better, sir?
A little bit.
Okay. For circulation then, do I see any signs of major bleeding at this point?
None.
Okay. What's his skin color, temp, and condition?
He's diaphoretic, flushed.
Okay. My decision at this point in time is he's exhibiting some classic signs of a possible cardiac incident. I'm going to go ahead and load and go. We're going to transport to meet with ALS ambulance. Okay, from here I'm going to go ahead and check on my sample history. So, sir, I'm going to ask you, about how long ago did this start?
About 30 minutes ago.
Okay. And does anything seem to make the pain better or worse?
No.
No. Can you describe the pain for me?
It feels like an elephant sitting on my chest.
So kind of a crushing type sensation.
Yep.
You mentioned your left arm is tingling, is that correct?
Yep.
Do you have any pain in your left arm or shoulder? Is the pain moving around other than just your chest?
No, yeah, it's painful and it's tingling.
Okay, and your left arm primarily?
Yep.
All right. On a scale of 1 to 10, with 10 being the worst pain you've ever felt, 1 being a mosquito bite, where would you rate this?
I would say this is an 8.
An 8? Okay. And you said this started about a half hour prior, so it's been going on 30 minutes, give or take.
Yep.
Okay. Are you allergic to anything?
Not that I'm aware.
Okay. Are you on any medications?
Nitro, and I do have a aspirin regimen, 81 milligrams a day, and I have taken that today.
Okay. Regarding your past medical history, have you ever been diagnosed with any heart problems or related type issues?
I had a stent put in 4 years ago.
4 years ago. Okay. Did you have anything for breakfast or lunch today?
I had a sandwich for lunch, just a bagel for breakfast.
Okay. How long ago did you have lunch?
About 2.5 hours ago.
Okay. Did you have anything to drink with that?
Just a pop.
Okay. And what were you doing when the pain started today?
Just sitting on the couch watching TV.
Wonderful. Now I'm going to go ahead and move into my secondary assessment. Again, I'm assuming this is a cardiac type of incident. So what I'm going to do is I'm going to go ahead and expose his chest since we're in the ambulance on the way to meet ALS. And I'm going to take a look at his chest. I'm going to auscultate his lung sounds. How do his lungs sound to me?
Clear bilaterally.
Okay, no concerns there. And do I see anything that would indicate any signs of trauma to his chest or upper abdomen, anything like that?
Nothing noted.
Okay. My field impression, I'm going to go ahead actually at this point and get my baseline vitals. I know I've already gotten respirations done, but I'm going to go ahead and take a look at his blood pressure. What's his blood pressure at?
130/60.
Okay. And his pulse?
It's at 72.
Wonderful. And what are his respirations at
They're
now with the
at
O2?
18 and shallow.
Okay. My field impression of the patient at this point in time is, again, it does appear to be a cardiac type of incident. He does have a medical history for it. He's experiencing a lot of the classic signs and symptoms. He is approximately 44, 45-year-old male and does appear to be in pain due to the chest pain he's experiencing. And again, I'm seeing signs like diaphoresis, etc. Interventions. You mentioned, have you taken your nitro today?
I took one nitro when the pain started, yeah.
Okay, and did you take your low-dose aspirin this morning?
Yeah, I took it this morning.
Okay, did the nitro seem to help with your pain?
Just for a little bit, yeah.
Okay. Are you on any erectile dysfunction medication
No.
at this point in time? No. Okay. I'm going to go ahead and verify the 5 R's of his medication. As long as those are correct, I know I have standing orders that I can assist in administering another dose of nitro, so I'm going to go ahead and administer that. Sir, if you go ahead, open up your mouth for me, lift up your tongue, and give you some nitro right under. Give him 1 spray. In addition to that, I'm going to give you these 4 low-dose aspirin. What I want you to do is chew them up and swallow them. I know it's going to be bitter for you, but that helps it get into your system quicker, okay? Go ahead and take those. After I've done that, I want to reassess. I want to get his blood pressure specifically and see how far that's dropped.
His pressure now is at 100/50.
100/50, okay. And why don't I go ahead and get pulse and respiration again, just double check that.
Respirations are at 15, and his pulse is at 74.
Wonderful. And sir, did that seem to help your pain at all? Is it still an 8 or did it get any better?
It went down a little bit. I'd say probably maybe a 6 right now.
6, okay. We're going to go ahead and continue transporting. As soon as I meet up with ALS, I'm going to report to my ambulance, to my paramedics, that what I have here is a 44-year-old male experiencing chest pains. He, upon my arrival, was diaphoretic and has appeared flushed. He didn't have any sort of traumatic injury, no need to consider C-spine. The chief complaint, again, was his chest pain. He also mentioned tingling into his left arm and some pain in his left arm. He's prescribed nitro, and he's also on an aspirin regimen. He took his 1 aspirin this morning, his 81 milligrams this morning, and took 1 dose of nitro prior to my arrival. Since then, I've given him 4 more aspirin and also another shot of nitro. His pain did drop from an 8 to a 6 at that point in time. Blood pressure initially was 130/60. It's now down to 100/50 after the second administration of the nitro. Pulse is 72, respirations are 18, and we've had him on oxygen basically since I got here.